Taking care of your body is fundamental to living a healthy, satisfying life. And when it comes to personal hygiene, sexual health, and overall well-being, caring for your penis is an essential part of the equation. Yet, it's a topic that often gets overlooked, whether due to embarrassment, lack of information, or simply not knowing where to start. But just like any other part of your body, the penis requires attention, understanding, and regular care to avoid health issues, boost confidence, and maintain optimal function. From hygiene routines to recognizing signs of potential problems, there are straightforward practices every man should adopt. Here are 5 essential care tips you need to know to keep your penis healthy, comfortable, and functioning at its best. The first and most foundational aspect of penis care is proper hygiene. The penis comes into contact with sweat, urine, and bacteria on a daily basis, and neglecting regular cleaning can lead to a wide range of problems. One of the most common issues is the buildup of smegma, a combination of dead skin cells, oils, and moisture that can accumulate under the foreskin in uncircumcised men. If left unchecked, smegma can cause odor, irritation, and even infection. For circumcised men, while there's no foreskin to clean under, it's still important to keep the area clean to prevent irritation and bacterial growth. Washing your penis should be a part of your daily routine, just like brushing your teeth. Use warm water. Avoid harsh soaps or scented products, which can irritate sensitive skin. If you're uncircumcised, gently pull back the foreskin and clean underneath. Then rinse and dry thoroughly. Circumcised men should ensure to clean around the glands and shaft, rinsing away any sweat or residue. After cleaning, make sure the area is dry, as moisture can promote fungal infections. Good hygiene not only keeps you comfortable, it's the first step in preventing more serious health issues. The second essential care tip is to pay attention to the skin and overall health of your penis. The skin on the penis is delicate and can be affected by a variety of factors, such as friction, allergic reactions, and infections. Be mindful of the products you use in the shower. Opt for mild, fragrance-free soap if you use any at all, and avoid body washes with harsh chemicals. If you shave or trim pubic hair, use clean tools and be gentle to avoid nicks and cuts. Always moisturize if the skin feels dry, but choose creams that are specifically formulated for sensitive skin. If you notice any rashes, irritation, unusual bumps, or discoloration that don't go away within a few days, consult a healthcare professional. These symptoms can sometimes be harmless, but they can also signal infections, allergic reactions, or even early signs of skin conditions or sexually transmitted diseases. Regularly inspect your penis for any changes. Be aware of what's normal for you, and don't hesitate to seek medical advice if something seems off. Taking care of the skin not only keeps you physically healthy, but also boosts confidence and comfort. The third crucial aspect of penis care is practicing safe sex and being proactive about sexual health. Sexually transmitted infections, STIs, are a real concern, and prevention starts with awareness and responsible behavior. Always use condoms during sexual intercourse with new or non-monogamous partners. They are the most effective way to protect against the majority of STIs, including chlamydia, gonorrhea, syphilis, and HIV. Even if you're in a long-term relationship, it's wise for both partners to get tested before becoming sexually active without protection. Regular STI screenings are important, especially if you have multiple partners. Learn the symptoms of common STIs, pain, discharge, sores, or unusual odor, and get tested promptly if you notice anything abnormal. Remember, some infections can be asymptomatic, meaning you might not show symptoms but can still transmit them to others. Practicing safe sex isn't just about physical health, it's about respect for yourself and your partners, fostering trust and ensuring everyone involved feels secure. The fourth tip centers around understanding and maintaining erectile health. Erections are a complex interplay of blood flow, nerve signals, hormones, and psychological factors, and they're a strong indicator of overall health. Lifestyle choices play a huge role in maintaining erectile function. Regular exercise is vital. Cardiovascular activities like jogging, swimming, or cycling improve blood flow, which is essential for healthy erections. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supports heart health and hormone balance. Avoid excessive alcohol and don't smoke. Both habits can damage blood vessels and nerves, impairing erectile function. If you notice changes in your erections, such as difficulty maintaining them, reduced sensitivity, or pain, it's important to consult a healthcare provider. Erectile dysfunction can be a sign of underlying health issues like diabetes, high blood pressure, or cardiovascular disease, and early intervention can prevent more serious problems. Managing stress is also crucial. Chronic anxiety or depression can negatively impact sexual function. Don't ignore mental health. Talk to someone you trust or seek professional help if you're struggling. Taking care of your erectile health is about more than just sexual performance. It's a window into your overall well-being. The fifth and final essential care tip is to recognize when to seek medical attention and understand the importance of regular checkups. It's easy to put off seeing a doctor about intimate issues, but early diagnosis and treatment are key to preventing complications. Some symptoms should never be ignored. Persistent pain, swelling, lumps, sores, unusual discharge, or blood in your urine or semen warrant a professional evaluation. Testicular health is closely linked with penile health, so regularly check your testicles for lumps or changes in size or texture. Men over the age of 40 should consider regular prostate exams, as prostate health can affect urinary and sexual function. If you're experiencing frequent urinary tract infections, difficulty urinating, or unexplained changes in sexual function, don't hesitate to see a medical professional. Many conditions, from Peyronie's disease to infections and even cancer, can be treated effectively if caught early. Remember, there's no shame in asking questions or seeking help. It's a sign of responsibility and self-respect. Routine checkups with a healthcare provider, including sexual health screenings, should be part of your overall health plan. While these 5 essential care tips cover the basics, there's more to consider when it comes to holistic penis health. Diet and exercise, mental well-being, relationships, and open communication all play interconnected roles in supporting sexual health and confidence. Let's delve deeper into each of these areas to empower you with practical knowledge. Nutrition has a direct impact on sexual function and penile health. Foods rich in antioxidants, vitamins, and minerals support circulation and cell repair. Leafy greens like spinach and kale provide magnesium, which helps relax blood vessels and improve blood flow. Fruits such as berries, citrus, and watermelon contain compounds that boost nitric oxide production, a key factor in erections. Oily fish like salmon and mackerel offer omega-3 fatty acids, which reduce inflammation and support vascular health. Nuts and seeds provide zinc, essential for testosterone production and sperm health. On the other hand, diets high in processed foods, sugar, and unhealthy fats can contribute to obesity, diabetes, and vascular disease, all of which negatively affect sexual health. Drinking plenty of water aids in overall function, including circulation and skin health. If you have specific dietary concerns or underlying conditions, consult a nutritionist or healthcare provider for personalized advice. Physical activity is another cornerstone of penis care. Exercise improves cardiovascular health, supports hormone balance, and lowers stress, all crucial for sexual function. Aim for at least 150 minutes of moderate aerobic exercise per week, such as brisk walking, swimming, or cycling. Strength training helps maintain healthy testosterone levels and muscle mass. Stretching and yoga can improve flexibility and pelvic floor strength, which supports erectile function and urinary health. The pelvic floor muscles play a significant role in sexual performance. Simple exercises like Kegels can strengthen these muscles and improve control. To perform Kegels, contract the muscles you'd use to stop urination, hold for a few seconds, and release. Doing a few sets daily can make a noticeable difference over time. Regular exercise also helps maintain a healthy weight, Obesity is a risk factor for erectile dysfunction and other sexual health issues. Mental and emotional health are equally important. Stress, anxiety, depression, and relationship issues can manifest as sexual dysfunction or discomfort. It's vital to address mental health proactively. Practice mindfulness, meditation, or relaxation techniques to reduce stress. Open communication with your partner about desires, boundaries, and concerns fosters intimacy and trust. If you're struggling with sexual performance, don't be afraid to discuss it with your partner or a healthcare professional. Sometimes, simply talking about worries or insecurities can alleviate psychological barriers to enjoyment and function. If issues persist, counseling or therapy can provide support and guidance. In relationships, mutual respect and understanding are foundational to sexual health. Consent, communication, and consideration are essential. Never feel pressured to do something you're uncomfortable with, and always respect your partner's boundaries. Be honest about your sexual history and health, and encourage your partner to do the same. If you or your partner are experiencing sexual health issues, approach them with empathy and patience. Many problems, from low libido to erectile dysfunction, are common and treatable, but stigma and shame can prevent people from seeking help. Remember, sexual health is a shared responsibility. Supporting each other leads to deeper connection and satisfaction. Beyond these lifestyle factors, there are specific conditions and concerns unique to penile health that every man should be aware of. Let's explore some common issues, how to recognize them, and what steps to take if they arise. Balanitis is an inflammation of the glands, often caused by poor hygiene, infections, or irritants. Symptoms include redness, swelling, pain, and sometimes discharge. Treatment depends on the cause. Improved hygiene, antifungal or antibacterial medications, and avoiding irritants usually resolve the issue. If symptoms persist or worsen, seek medical advice. Phimosis is a condition where the foreskin cannot be fully retracted over the glands, which can lead to discomfort and increased risk of infection. Mild cases may benefit from gentle stretching exercises and improved hygiene, but severe cases might require medical intervention, such as topical creams or circumcision. If retraction is painful or impossible, consult a healthcare professional for guidance. Peyronie's disease involves the development of fibrous scar tissue inside the penis, causing curvature during erections. While mild curvature is normal, severe bending can cause pain and interfere with sexual activity. Early treatment options include medication, injections, or physical therapy, while advanced cases may require surgery. If you notice a sudden or worsening curve, lumps, or pain, don't delay seeking medical evaluation. Priapism is a prolonged, painful erection not related to sexual arousal. It's a medical emergency. If an erection lasts longer than 4 hours, seek immediate care to prevent permanent damage. Priapism can result from certain medications, blood disorders, or injury. Prompt treatment is essential to preserve erectile function. Sexually transmitted infections, STIs, remain a major concern. Common STIs affecting the penis include herpes, syphilis, gonorrhea, chlamydia, and human papillomavirus, HPV. Symptoms vary: sores, discharge, pain, itching, or warts. Some STIs can be asymptomatic, making regular testing vital. Most are treatable, but early detection is crucial to prevent complications and transmission. HPV can lead to genital warts and, in rare cases, penile cancer. Vaccination against HPV is recommended for young men and those at risk. Practicing safe sex, regular screenings, and open communication with partners are the best defenses. Penile cancer is rare, but it's important to recognize the signs: persistent sores, lumps, ulcers, or changes in color or texture. Early-stage cancer is highly treatable, often with minor surgery or topical treatments. Risk factors include HPV infection, smoking, and poor hygiene. If you notice any unusual changes, see a doctor promptly. Erectile dysfunction, ED, is common, especially with age, and can result from physical, psychological, or lifestyle factors. Occasional difficulties are normal, but persistent problems warrant medical evaluation. Treatments range from lifestyle changes and counseling to medications and devices. Addressing underlying health conditions like diabetes, heart disease, or hormonal imbalances is crucial for effective management. Premature ejaculation is another common issue, affecting many men at some point. While it's often psychological, factors like stress, anxiety, or relationship dynamics can contribute. Behavioral techniques, counseling, and medications can help. Open communication with your partner and professional guidance are key to finding a solution. Penile injury, though rare, can occur during vigorous sexual activity, accidents, or sports. Symptoms include pain, swelling, bruising, or loss of function. Immediate medical attention is necessary for severe injuries, such as penile fracture, a tear in the tunica albuginea, the tissue surrounding the erectile bodies. Early treatment prevents complications and promotes healing. Urinary issues, such as pain, burning, or difficulty urinating, can signal infections, inflammation, or prostate problems. If symptoms persist, seek a medical evaluation to rule out underlying conditions and receive appropriate treatment. Sensitivity changes, whether increased or decreased, can result from nerve issues, injury, or psychological factors. If you notice persistent numbness, tingling, or loss of sensation, consult a healthcare provider. Taking proactive steps to care for your penis is about more than avoiding disease. It's about embracing overall wellness, confidence, and satisfaction. Regular hygiene, mindful skincare, safe sexual practices, healthy lifestyle choices, and routine medical checkups form the foundation of lifelong penile health. Equally important is open communication, self-awareness, and a willingness to seek help when needed. Remember, your penis is part of your body, deserving of respect, care, and attention. Prioritizing its health can enhance not only your physical well-being, but also your emotional and relational happiness. Whether you're young or older, single or in a relationship, these essential care tips empower you to take control of your sexual health and enjoy a life of comfort, confidence, and fulfillment. In summary, the 5 essential care tips for your penis are: practicing daily hygiene, maintaining healthy skin and inspecting for changes, engaging in safe sex and regular STI screenings, supporting erectile health through lifestyle choices, and seeking medical attention for any concerning symptoms. By embracing these habits, you're investing in your long-term health, boosting your confidence, and taking meaningful steps toward a satisfying, vibrant life. So, don't wait until a problem arises. Start today. Make penis care a routine part of your life, just like caring for any other part of your body. The benefits are far-reaching, from improved comfort and confidence to better sexual function and reduced risk of disease. With knowledge, attention, and openness, you can ensure that your penis stays healthy, happy, and ready for whatever life brings your way.